in your lap.
All right, so here we are back, Senate Health and Welfare. We are moving on to H72, and we have the director of the Rutland Dismas House with us to offer some comments let me just, before you begin, Representative McGuire, are other witnesses already on Zoom?
Yes.
Okay, so try to keep it as concise as possible, because we can put your testimony on our webpage and we know where you live.
For the record, Representative Eric McGuire, Rutland City, also the director of the Dismas House. I appreciate the opportunity just to share very, very briefly some of our thoughts, most of facts. As we know, this bill was passed out of the House, and this is not the approach currently at this time. The state of Vermont does not have the infrastructure of continuum of care to support this harm reduction model. This harm reduction model is not sanctioned by SAMHSA, it's sanctioned by the National Health Association. It's against the law. It is under the Controlled Substance Act, in which they currently are illegal now. There is no forward movement in regards to what's established in New York, and I'm not going to speak of that site. I have seen it, but yet I am not in the position to speak in regards to it. I have seen what has been conducted in Rhode Island. Rhode Island legislation did pass a law to implement safe injection sites in Providence. At this time, they are not operational, but to Rhode Island, their infrastructure of continuum of care is very robust. Ours in the state of Vermont is not. We do not have the infrastructure to support these sites at this time. There may come a time when they are sanctioned by our national health organizations and sanctioned within the harm reduction model of SAMHSA, then we can look at crossing that bridge. 6 other states have explored safe injection sites. They were guided by their feasibility studies. We in this state were not. We did not conduct a feasibility study. Yes, I do understand there is one that was available back in 2019, but the game has changed in regards to the substances that are out there currently. Fentanyl and xylazine are lethal substances. They are the things that are killing our loved ones. We need to invest in the evidence-based best practices currently. That's prevention and education, recovery, treatment, and enforcement. That's the harm reduction model. Whether we need to expand the hub and spoke model, which we did recently a couple of years ago, we have expanded that. And has it been effective? We have seen outcomes. But to implement this level of strategy at this time, it could be very, very problematic, harmful, and will result in unintended consequences. What I ask is that we really look at the evidence behind some of this. The evidence of overdose prevention sites, it is inconclusive. Many studies in favor of these sites suffer from fatal flaws, such as failure to include control groups or consider other variables. For example, one of the most well-known studies that looked at Vancouver's experience failed to consider a major police crackdown on drug use that was implemented during that study period. Meanwhile, other studies such as the 2012 Lancet study and the 2004 International Journal of Drug Policy study have found increases in overdose mortality and drug-related crime following the opening of these sites. I also want to, put some emphasis into some of these other studies that have been conducted. 80% of all studies that have been conducted on safe injection sites have mainly been from the Vancouver Insight. And if you look even deeper into those studies, they were conducted by pretty much in a biased way of people that work there. Nobody will dispute that no individual has lost their life at a safe injection site. Nobody will dispute that. If an overdose occurs on the site, there is proper responses there. But there is no evidence, there is no data, there is no studies that have been produced that track whether or not people engage into the effective services to get them from using the site. There is no studies that are out there that share whether or not individuals that were participating at the site and then ended up using it at another location died of an overdose. Those things are not readily available. I don't know how to track them and so forth. I think there needs to be a lot of discernment implemented, and I'm seeing a strategy that's being produced right now in Vermont. Where's the feasibility study currently?
The governor vetoed the feasibility study.
Yeah.
I understand that. Then why don't we just go back and maybe look at reinstituting that bill to get the feasibility study done?
Because we have a crisis in our state that needs immediate action right now,
Okay,
right now. And the governor's gonna veto this bill as well, and we need to act. And you come in here and say we need a study, when we've tried that multiple times and it's been vetoed multiple times.
So we'll get to the conversation, and I think you're hearing.
may I respond to that, Madam Chair?
Yeah, I don't want to get into conversation. You can, let Senator Gulick ask her question, and then we'll let you give some final comments and wrap. Yeah, we'll do that.
Mike, so a statement and comment. First, my statement is that your statement to categorically say we don't have the infrastructure, that's a big statement to make.
That's correct.
Okay, I guess I would want to dig into that a little bit more. It's a big thing to say. Did you know that we've had 23 letters sent to this committee in favor of OPCs by various organizations? And if you permit me to read who those organizations are, that'd be really great.
They are on our webpage. You can
They are.
a couple, just a
Okay.
couple.
I'll read a couple. Vermont Cares, Recovery Vermont, Vermont Association for Mental Health and Addiction Recovery, Pathways, Law Enforcement Action Partnership, Vermont Interfaith Action, Drug Policy Alliance, Dr. Lincoln Health's letter to Dr. Lincoln, Out in the Open, Ben and Jerry's, House and Homelessness Alliance, Vermont Business for Social Responsibility, ACLU-VT, AIDS, United, National Healthcare for the Homeless Council, Fair and Just Prosecution, Vermonters for Criminal Justice Reform, Professional Firefighters of Vermont. I think Planned Parenthood is submitting a letter, and the Vermont Medical Society, and American Society of Addiction Medicine, the American Academy of Family Physicians. So that's a pretty comprehensive list.
So, but we do appreciate your comments from your perspective and understand that your work at the Dismas House with transitional housing does expose you to some gaps in the system. And I think it's important that we continue to work on those gaps. This may well fill one of those gaps, but I know that you wanted to. Senator Williams has a question, but then we're going to allow for Representative McGuire's wrap.
Okay, well, that's what I want, but I was gonna have him, the guy with the boots on the ground.
Mhm.
That's seen these sites in operation, I'd like to hear having wrap.
Good back.
The perspective I was coming at, Senator, was I am boots on the ground. There may come a time that this is implemented as part of SAMHSA and the National Health Institute's harm reduction model, but at this time, that is not part of their harm reduction model. Therefore, I follow the guidelines of these organizations that guide us in our practices. Whether I agree or disagree is not relevant. The relevancy is that are we practicing the evidence-based best practices strategies as laid out by our national health organizations. That's where I'm coming from. I am boots on the ground. I do see these on a daily basis. I engage in on a daily basis. There are many individuals that I have worked with that have tragically passed away from overdose death. I have seen the effect of this on our communities just like you have. And I respect where you are coming from in regards to your premise. I just believe that at this time, we have the capability of expanding our proven practices, whether it's more monitored detox beds, whether it's more education, whether it's more prevention, whether it's more recovery. That's where I'm coming from. I just see if this is the path and we're going to invest in and not invest into the proven strategies, over time will result in some unintended consequences.
Thank you. I mean, that was extremely clear and it's a very valid position for you to have. And we appreciate it.
Thank you.
And I will say, one of the things that we've learned over time is that our federal friends learn from what states need and do. And this may be that case.
And that's,
Now, we're gonna move on.
I
My
understand.
comment, we're ended,
Okay,
and I'm gonna move to the folks who are up on Zoom, waiting to testify.
Thanks.
So, no, but thank you, appreciate it. Scott, thank you for being here, and also, former mayor, Moreau, welcome. We have about 25 minutes left, and I don't know if you two coordinated, in your testimony. I was thinking that, Mayor, Weinberg might go first. How do you, have you coordinated in any way, or do you want me to just say go?
Well,
Haven't
Scott and I have
coordinated,
worked
but
together for a long time, so
The answer is you haven't coordinated. Yeah. Thank you. Go ahead, Mayor. It's good to see you.
okay, good to see you, Senator. I appreciate the invitation and that it's nice to know that there's some interest in what I have to say, even though I'm now a has-been on the.
Okay, let me clarify this. You're not a has-been. I know how hard you've been working on this in the city of Burlington and also on the advisory committee. And I know that when we met a couple months ago at the Burlington Electric Department, you were very interested in testifying. And I've wanted you to do that. And if we need to bring you back in another day, we will do that. But we want to hear your testimony today and see how far we get. And also to have Scott in, because you and he have worked very closely together.
Yeah, that's right. Thank you, Senator. Yes, the city of Burlington's been very focused on opioid crisis strategies really since the fall of 2015. I will always remember September 1st, 2015, I appointed Chief Del Pozo to be the new Burlington Police Chief and announced publicly that his first priority was going to be reviewing all of Burlington's strategies, both from an enforcement and treatment harm reduction perspective in response to the opioid crisis. It might have been a little of a strange thing to ask a police chief to do, but I didn't. The city of Burlington has never had a health department. We had no one who was as exposed and working on the issues as the police department back then. That's why I asked the police chief to do it. And ever since then, it's been one of Burlington's top priorities, and I do believe it will continue to be a top priority under the current administration from my conversations with now Mayor Emma Mulvaney Stanek. I've long supported overdose prevention sites as a strategy. I will say I've become increasingly focused and increasingly believe that this is something that we urgently need to pursue. And I say that for a number of reasons. First of all, I have been following and been seeing presentations on the academic studies, the increasing amount of literature and research that is showing that the existing overdose prevention sites in Canada, in the United States, elsewhere in the world is having a positive impact on a number of key metrics. First of all, clearly there is we know, and I think it's undisputed, as you heard from the last speaker, people do not overdose and die when they are using these facilities. There have been thousands of overdoses reversed, lives saved, and that has always been a North Star in our work to save lives. I also think it is these facilities are life-saving from the perspective that they become very clearly another pathway into treatment for a large percentage of the people who use the sites. My understanding is in New York City, about 50% of the people who have been going to that facility go into treatment. I recently heard of another study showing that within 2 years of starting to access an overdose prevention site, 42% of the individuals go into medically assisted treatment. This is particularly important right now when the Department of Health's own statistics show that a very large percentage of the people that we are losing to overdose deaths are not in treatment and have never been in treatment. My understanding of the 2002 Department of Health data, the most recent kind of year that we have good social autopsy work for, is that 75% of the people who overdosed and died were not in treatment and had never been in the Department of Health's system, in the hub and spoke system. And, you know, that is, to me, that's just a very damning statistic. For that to be the case, you know, more than a decade into our work setting up the hub and spoke system, is an indication that the people that would most benefit from that system are really, a large percentage of them are being missed. This is another way, this is a way that we clearly would reach some of those folks. And then finally, a really important point, I think, and one often underappreciated in the discussion, is that studies are showing that these facilities reduce, they don't, not only do they not increase, they reduce crime and disorder in the area immediately around the facilities. I think that surprises many people. I think there's a concern that this is going to be another factor that's going to add to the very disturbing levels of crime and disorder that we are seeing across the state of Vermont. This is an indication that actually these facilities work otherwise. And, you know, it makes sense when you kind of unpack it. You are taking some of the activity that the public finds very disturbing, of people publicly injecting, and that activity is going inside into a facility that's intended for this and can support it, and it has a positive impact on the neighboring community. I do find some of the criticisms or concerns about this strategy for Vermont generally to be, you know, potentially, I don't think, I at least don't think they can be dismissed, in that, you know, we are a rural state largely, and have, this may not be a strategy that makes sense for some of the areas of the state where we have the highest overdose rates, which are not in Burlington. They are in other parts of the state that are more rural parts of the state. That said, the biggest concentration, you know, by number of overdoses and public emergency response, public service response, public safety response to overdoses does happen in Burlington. And if I don't know if I've been enabled to share a screen, I'm going to try. I don't have that capacity, but maybe I could be added. I do have a little graph that shows the concentration in Burlington.
You can go ahead.
All right, I'm trying to do that, and it's okay. Hopefully, sorry, give it one more second.
No, technology is so fun.
Yeah, it's the interface on my end is not really working. So you can imagine it. Basically,
Wait, before you finish here, can you send us your testimony, include the graph, include that data?
I will definitely send the graph. Yes. And
Okay.
what it shows is an incredible concentration of overdoses and public safety response right in the center of downtown Burlington. So
Yes.
we have a real concentration issue in Burlington, and, you know, Burlington is, last I checked, an important part of this state, and should be something that is a state concern as well as a municipal concern, that we are having this kind of challenge in the downtown. I think a couple other quick points. I know you're tight on time. I think it is important to note that in Burlington, this may be a controversial strategy statewide. It is not a controversial strategy in the city of Burlington. We have had support from across the political spectrum for this strategy for years. Every time this issue has come to the city council, I believe it has come 4 times. There has been unanimous votes. And I'll have to double check that. As I say that, I wonder if that's the case, that always it's been unanimous. I know the most recent time that this was voted on by the city council was a unanimous vote in support of overdose prevention sites. Maybe Scott, you could follow up with that to confirm that. There was also a very high profile letter raising public safety concerns that was signed by, I believe, 1,400 Burlingtonians and Burlington organizations last fall. It included everyone from the Chamber of Commerce to harm prevention advocates. And one of the strategies endorsed in that letter was overdose prevention site facility. I do want to make an observation, not just with my Burlington hat on, but with having served on the Overdose Settlement Advisory Committee since its inception a year ago until just this last Monday when I left office. I do want to make sure the committee is clear that despite the communication that you received from the Commissioner of the Department of Health, the committee, which did not have as a recommended use of the settlement funds overdose prevention sites, the committee has strongly supported using funds for that purpose. And I believe, having served on the committee, been part of that debate, also having had the experience as mayor of going onto radio talk shows and having to face scrutiny from the public and having to answer tough questions from individuals about, why are you using my tax money to pursue this strategy that I don't support? My answer has been, that's actually not the proposal I support. I think we should use these settlement funds that come from the pharmaceutical companies, that come from the drug companies and distributors that really launched this problem, that we use those funds from those corporations to fund this promising strategy, and that we are not using tax dollars or even to do that. Further, I understand there is this expanded fee that is on, I believe, on drug companies that would, in the current version of the bill, that would pay for this. I believe that gives the governor, who has made his concerns about this strategy very clear, it gives him yet another reason to veto such an effort, given such legislation, in that it would not only be funding a strategy that he has concerns about, but it would be violating one of his principles of not expanding revenues or fees, taxes or fees. And for that reason, I think switching to the settlement dollars would be advisable. Couple final points, really last point. If somehow this strategy, this legislation is finally passed this session, I would encourage you to think about the implementation and how if your intent as a legislature, as a Senate, is to actually see on the ground progress with this strategy. I have grave concerns about delegating, about sending these resources and the mandate to the Department of Health to actually pursue this. I have that concern for a number of reasons. One, there's clearly capacity concerns at the Department of Health. I think, from my perspective, the $8 million that the legislature appropriated for settlement for harm reduction and opioid strategies last May, very little of that money has yet to have an on-the-ground impact nearly a year later. The one that maybe is most comparable and is most concerning is the expanded methadone access that the legislature overwhelmingly supported last May. This is something that is needed today in the fentanyl era. We know that methadone is a successful treatment drug against fentanyl, even when, in many cases, buprenorphine we have struggled with. It is buprenorphine our other major treatment drug is no longer nearly as effective in many cases with when the person that we're trying to treat has been addicted to fentanyl. Methadone still works. For more than a year now, I have been advocating trying to get an expanded methadone access in downtown Burlington, a methadone dosing unit. And the Department of Health has moved very slowly on that effort. They did not, despite the urgency with which the legislature appropriated these funds in May, there was no action on it until August when Senator Hardy and I were kind of flushed out in one of these advisory committees that nothing was happening with that funding. It took until after Thanksgiving for the RFP to be put on the street. The submissions in response to that RFP have been in since the end of January. And unless something has happened this week, as far as I'm aware, it is now 2 months later. And there is still more than 2 months later, and still there has not been an announcement about funding for those methadone dosing units. And the projections from the Department of Health is that it's going to be another 12 to 18 months before anything happens there. Doesn't have to be that way. It's entirely about whether or not this is a implementation priority. I do think probably the legislature could do more to give the Department of Health the capacity to be able to pursue some of these new initiatives. But it also needs to be a priority for the department and the department leaders. And clearly, even the existing harm reduction efforts have not been a priority. So if you do this, I would consider maybe direct appropriations from the legislature to entities that do want to pursue on the ground progress, such as the city of Burlington, such as some of the treatment agencies that are eager to have these funds and would move on them as soon as funds were dispersed. Instead, which is, I think, absolutely was needed in a time when we were losing people just about every day to this terrible scourge. Thank you, Senator. I hope I haven't gone on too long.
Yeah, no, that was terrific. And what I'm going to do is there are questions and comments to be made, but I'm going to just say thank you and please stay available if you can while Scott offers some comments. We may actually have, Scott, I don't know what timeline you have. We have a short timeline. We'd like to hear your comments, and then we may actually invite you back another day as well. So we're going to listen to you today and have you back. But Mayor Weinberger, the comments that you made at the end about the Department of Health and the lack of resources available to them to implement what we asked them to do is very well taken and is contrary to what we hear from the administration. And so, but your comments are extremely well taken. And as we work in here and make recommendations to the Appropriations Committee, we will carry these thoughts with us. So I thank you very much for that. At least I'll carry those thoughts with me when I'm down the hall, but I really appreciate that. So Scott, welcome. And please don't go away, Mayor.
Thanks. I timed this under 10 minutes and Moreau has helped me skip the first 2 paragraphs. So I'm Scott, substance use policy analyst for the city of Burlington. I'm a member of the Opioid Settlement Advisory Committee and the Substance Misuse Prevention Council. In early 2019, the city of Burlington held a press conference to announce that Chittenden County experienced a 50% reduction in overdose deaths in the previous year. This change was attributed to harm reduction interventions and treatment access improvements, including decriminalization of buprenorphine possession without a prescription, elimination of waitlists at our local hub, and implementation of a low barrier medication service at Burlington's syringe service program. Despite continued efforts to improve treatment access and to promote engagement with harm reduction services, changes in the illicit drug supply have eroded the efficacy of traditional approaches to curbing overdose deaths. In both 2021 and 2022, Chittenden County witnessed triple the number of opioid-related fatalities that it did in 2018, the year many policymakers cite as evidence we were turning a corner in the overdose crisis. Recently, this committee heard testimony that suggested the state's overdose deaths have plateaued. This eagerness to point to a still unacceptable number of Vermonters lost to preventable overdose as proof that our harm reduction and treatment strategies are sufficient reminds me of policymakers' arguments to hold off on implementation of life-saving programs like overdose prevention centers over the years. Burlington's need for an overdose prevention center has been apparent for some time now. Our community heard many years ago that an overdose prevention center may save just a single life each year. But last year, we observed 2 overdose reversals in the first 3 nights of the city's extreme cold shelter operations. We have witnessed an explosion in demand for emergency medical service responses to overdose incidents in our community. New adulterants are found in the illicit opioid samples throughout the state with alarming regularity. This overdose crisis continues to worsen, posing increased risk of mortality and other health harms to our friends and neighbors, not just those dependent on illicit opioids, but for anyone who may use any unregulated supply of drugs for a variety of reasons. A saying I heard often in the earliest days of my personal recovery from substance use disorder was that half measures avail us nothing. I encourage the legislature to consider that proverb when assessing our state's system of harm reduction and treatment services. You have heard about new promising approaches to address the overdose crisis that seem to me to be half measures relative to the utility of overdose prevention centers. While we do have drug checking services in Burlington, the current policy landscape dictates a person might visit a local syringe service program, obtain safe use supplies, use checking services to estimate what substances are present in their personal pre-obtained drug sample, a sample that likely contains both substances on which they're dependent and others they might have never heard of or never intended to use. And then they must leave that space, which could otherwise be an overdose prevention center, just to use those drugs alone. Essentially, we limit our harm reduction program operators to saying to sick, marginalized members of our community, yes, your drugs are tainted. Yes, you're likely at risk of experiencing an overdose. Goodbye and good luck. You have heard about the promise of apps and hotlines, which might help alert emergency services to help individuals who experience overdose. Please make no mistake, relying on never use alone while using alone is still using alone. Calling in to a support service is not the same as using drugs in a medically supervised environment. The lives of overdose victims are still dependent on EMS, both their ability to locate individuals and the speed of their response. Please do not forget that non-fatal overdose incidents are still emergencies in which every second increases the likelihood of suffering negative health impacts which might last a lifetime. Promoting the use of overdose detection technology and drug checking services in lieu of comprehensive overdose prevention centers, especially for communities such as Burlington, where we know OPCs are likely to be utilized, is relying on half measures which avail us nothing. When we confirm for our neighbors that they're likely to experience a significant medical emergency and ask them to do so out of our sight, how can we be shocked that we continue to lose our friends and neighbors to preventable overdose death? As a policy expert and person who has lived in this crisis for now 16 years, I'm confident an OPC in Burlington would save lives. The brick and mortar pilot our community has called for may not be a perfect fit for other Vermont communities. But to deny Burlington the chance to move forward because this model may not be the most effective elsewhere is not a commitment to geographic equity. It's a commitment to inefficient practice and increasing death. You heard at least 2 statements in testimony yesterday which are incorrect. The statement that Brandon Marshall's study from 2011 is the only one evaluating the neighborhood level impact of OPCs is incorrect. Submitted with my testimony is a study published this February in The Lancet, which observed a 67% reduction in overdose deaths in the immediate vicinity of OPCs established in Toronto. You also heard that there is no evidence that accessing a site lowers an individual's risk of fatal overdose over time. That is also incorrect. The 2019 study I've submitted with my testimony demonstrated that frequent OPC use decreased the risk of all-cause mortality, which includes fatal overdoses, by more than 50%. I want to wrap things up by offering additional insight into the experiences of communities who have already implemented OPCs. You heard recently that Vancouver, British Columbia continues to witness increasing drug-related fatalities while having over 40 OPCs in operation. I ask you to consider what the death rates might look like without those life-saving services. The state's settlement committee heard expert testimony, which cited research estimating that at a point of accelerating death rates in British Columbia, Overdose death totals may have been 2.5 times worse without OPCs. As inhalation has become the most prevalent route of drug use involved in overdose incidents, British Columbia's chief coroner has called attention to the fact that less than half of the province's OPCs offered supervised inhalation services. British Columbia's experience addressing the overdose crisis does not suggest that overdose prevention centers are ineffective, but instead ought to encourage Vermont to implement the most comprehensive overdose prevention centers possible, wherever and whenever they are needed. We can be confident that Vermont, the where is at least Burlington, and the when is yesterday. I have advocated for OPC since 2018 before I participated in a conference celebrating a dip in deaths that now seems to have been just noise amid deafening signals that our approaches are not working. Since then, I have lost more friends and family members to overdose death in each passing year. Many left behind young children who will now carry the trauma and the burden of the overdose epidemic for the rest of their lives. Please seize this opportunity to act. You needn't wait to see which or how many of our loved ones we bury next. Crises demand comprehensive responses, and half measures avail us nothing. Thank you.
Scott, thank you so much, and thank you for your ongoing work. It has been remarkable and helpful to us, and I know you testified earlier in the session before 3 of our committees, and we really appreciate your time. So let's take a minute before our bell starts calling us to the floor, and I know there are some questions, so Senator Gulick, you had your hand up.
I mostly just have comments, actually. Scott, thank you for your testimony. That was moving and really important for all of us to hear. And I really appreciate you sending those 2 documents that kind of debunked what we heard yesterday. So thank you. Also, I just wanted to take a minute to thank Mayor Weinberger. I have not had the opportunity to say thank you for your incredible service to Burlington over the years. I did not make it to the bagel the other morning, so I apologize, but you really led the charge, and you've really gotten a lot of folks on board with OPCs, and I really thank you for that and your leadership.
Thank you,
Right.
Senator.
That is the word, leadership is the word, and Burlington has taken leadership for the state on this, and we greatly appreciate it. Any other questions?
I just want to echo what Senator Gulick said, and it's been great to serve with you on the opioid settlement committee, Mayor Weinberger and Scott too. I look forward to continuing, and at least 3 of us in this room are going to make sure that this bill passes. And thank you for your advocacy and all the work you've done, both of you. It's been really incredible.
So I do have one question for the mayor, and that is, are you going to continue your work in this area? What's next, I guess? For 30 seconds.
Well, thank you. Well, first of all, I appreciate everyone's comments. Thank you. They're touching. And yes, Senator Hardy, thank you for, I've appreciated our service together on that important committee, and hope that and believe that that committee will continue to play an important role going forward. And actually, some of the confusion around this year's communication, I think, means that the committee in future years will have a clearer and stronger process for getting recommendations to the legislature. Sarah Lyons, up until last Monday, I was very focused on finishing this 12 years in the mayor's office, right? And we had a very productive final 6 months on many fronts, and including something I didn't quite get to in my testimony, but we worked hard to get not only all of the opioid settlement funds that we get directly, and the city of Burlington is getting a couple $100,000 a year directly. We have committed some of our future funding to various strategies, including a new community response team, voluntary detail from the fire department that has been going since last October and has had very promising results. I'll actually try to show you one more image, or I'll send it along, showing just how there is a glimmer of hope that we have seen a change in the numbers since last October, when this strategy, as well as some of our interdiction strategies, seem to be kicking in. And for the last 6 months, we have had a marked reduction in the number of public safety responses to overdoses in Burlington. So at a time when there's, really not a lot of good news in this work, things have been going, we have seen some positive impact. And if I can find a way to continue work on this, it's certainly one of the most important issues I think out there. I would love to find a way to continue to engage this. Exactly how I do that yet, I haven't figured out, Senator.
Well, no, but thank you, and thank you very much for the work that you've done over the years. You stabilized Burlington's financial outlook. You brought a new look to public safety and to this problem, as well as to housing and transportation and improving the downtown. I will just share that publicly right now because I'm very appreciative of the work that you've done for the biggest city in our state. Thank you. So we need to wrap.